there is something I want you to think about before you schedule your next routine checkup. And I want you to think about it carefully, because after 60, one simple appointment can sometimes create a chain of events you never expected. A test, then another test, then a specialist, then a biopsy, then medication. And suddenly, something that started as a routine attempt to make sure everything is okay has turned into months of appointments, anxiety, procedures, and decisions you never thought you would have to make. Now, let me be clear. I am not telling you to stop seeing your doctor. I am not telling you to ignore symptoms. And I am certainly not telling you that preventive medicine is useless. Quite the opposite. Good preventive medicine can save lives. But there is a question that I wish more people over 60 asked before agreeing to a medical test. What happens if the result is abnormal? Because that question changes everything. I'm going to walk you through 5 common medical checkups that deserve a much more careful conversation after 60. And the 5th one is particularly important because it can turn a completely healthy person into a patient simply because modern technology found something that was never going to hurt them. But before we get there, I want you to understand the bigger problem, because these 5 tests are not connected by the fact that they're bad. They're connected by something much more subtle, something called overdiagnosis. Imagine you walk into your doctor's office feeling completely fine. You sleep reasonably well. You walk, you eat. You spend time with your family. You have no unusual symptoms. You simply want to stay healthy. Your doctor orders a test. The result comes back slightly outside the reference range. There's an asterisk beside your number. Suddenly, the word abnormal appears on the screen. And psychologically, something happens immediately. You stop thinking, I'm healthy. You start thinking, something is wrong with me. That single word can change the entire conversation. Your doctor may want to repeat the test. The repeat test may lead to another investigation. That investigation may produce another questionable finding. And before you know it, you're no longer trying to prevent disease. You're trying to prove that you don't have a disease. That distinction matters enormously after 60, because as we age, our bodies change. Heart rhythms change. Bone density changes. Hormone levels change. Blood chemistry changes. The prostate changes. The thyroid changes. And not every biological change is a disease. Sometimes an older body is simply an older body. The danger comes when we treat every difference from a younger person's normal as something that must be fixed. So let's start with number 5. And this one is probably going to surprise you. Number 5 is routine thyroid ultrasound in people who have no symptoms. Now, your thyroid is a small gland at the front of your neck. It helps regulate metabolism, energy, temperature, and a number of other important functions. And modern ultrasound technology is incredibly sensitive. That's the good news. But sensitivity has a downside. When a machine becomes extremely good at finding tiny abnormalities, it starts finding things that previous generations never knew were there. Small thyroid nodules are extremely common. Many of them never cause symptoms. Many never grow significantly. And many never become dangerous. But imagine you have a completely silent thyroid nodule. You don't feel it. You don't know it's there. It's not affecting your swallowing. It's not affecting your breathing. You feel perfectly healthy. Then you get an ultrasound. The ultrasound discovers it, and suddenly you have a finding. Now comes the difficult part. Your doctor may recommend another scan, then perhaps a needle biopsy. And if the result is uncertain, you may be sent to a specialist. In some cases, surgery enters the conversation. And now you have to make a decision about removing part or all of a gland that wasn't causing you any trouble in the first place. This is where the concept of overdiagnosis becomes so important. Finding something is not automatically the same thing as saving someone. Sometimes finding something early saves a life, but sometimes finding something simply starts a chain of interventions for a condition that would never have caused symptoms during that person's lifetime. That's the question you need to ask. Not simply, can this scan find something? Ask, if you find something, what happens next? And that question should be asked before the scan, not after. Now let's move to number 4. And this one sounds so responsible that most people would never question it. A huge annual blood panel. You know the appointment. You arrive fasting. Several tubes of blood are taken. Then a few days later, you receive a report containing page after page of numbers. Some are normal. Some are high. Some are low. And almost inevitably, 1 or 2 have a little red arrow beside them. That's when anxiety begins. Maybe your liver enzyme is slightly elevated. Maybe your kidney marker is slightly different. Maybe your calcium is a little outside the reference range. Maybe your blood count is slightly unusual. And now you're asking yourself, what does this mean? Here's the problem. The more measurements you take, the greater the chance that at least one will look unusual simply because of normal biological variation and statistical probability. A test can be perfectly useful when there is a specific reason to order it. But testing everything, simply because you can test everything, creates another problem. You start reacting to numbers instead of people. And after 60, that can become particularly complicated. Imagine a 68-year-old who feels fine. Her blood pressure is good. She walks every morning. She has no unusual symptoms. A massive blood panel reveals one borderline value. The doctor repeats it. It's still borderline. Now a specialist becomes involved. More testing follows. Eventually, she spends months worrying about a problem that may never have caused her any harm. This is why targeted testing is often a much better conversation. What symptoms do you have? What medications are you taking? What conditions run in your family? What risk factors do you actually have? What are we trying to detect? Those questions give a blood test context. A giant panel without context can create confusion. So the next time someone suggests, let's just check everything, don't panic. Ask, what specifically are we looking for, and what would we do differently depending on the result? That's an incredibly powerful question, because a test should ideally change a decision. If the result won't change what you do, you should understand why you're doing the test in the first place. Now we're moving into more sensitive territory. Number 3, PSA screening for prostate cancer in older men. And I want to slow down here, because prostate cancer is real. It can be serious. And for some men, screening and treatment can absolutely be appropriate. This is not an argument against prostate cancer awareness. It's an argument for individualized decisions. The PSA test measures prostate-specific antigen in the blood. An elevated PSA does not automatically mean cancer. That is important. PSA can rise for several reasons, including benign prostate enlargement and inflammation. But when the number rises, fear can take over, because the word cancer enters the conversation. And once cancer becomes a possibility, many people understandably want immediate action. That may mean additional testing, sometimes MRI, sometimes biopsy. And if cancer is diagnosed, treatment options may include surgery, radiation, or active surveillance, depending on the cancer's risk and the person's situation. Here's the difficult part. Some prostate cancers grow very slowly. They may never cause symptoms during a man's lifetime. Other prostate cancers are aggressive and require treatment. The challenge is distinguishing between them. That's why age, life expectancy, family history, previous PSA results, race and other risk factors, symptoms, and personal preferences all matter. A number on a piece of paper does not tell the entire story. So if you're a man over 60 and someone recommends PSA screening, don't simply ask, should I get the test? Ask something more intelligent. What is my personal risk, and what would we do if the PSA is elevated? Would you repeat it? Intelligent. What is my personal risk, and what would we do if the PSA is elevated? Would you repeat it? Would you use another test? Would imaging be appropriate? Would biopsy be necessary? Would active surveillance be an option if a low-risk cancer were discovered? You deserve to understand that chain before you enter it, because once a screening test is positive, the emotional pressure to do something can become enormous. And sometimes the wisest medical decision isn't the most aggressive one. Sometimes it's careful observation. Sometimes it's repeating the test. Sometimes it's doing nothing immediately. And sometimes treatment really is necessary. The point is that the decision should be based on the individual, not simply the number. Now let's talk about number 2. This one concerns something almost every adult over 60 should care about: your bones. And here's where I want to challenge a common assumption. A bone density scan can be extremely useful. For people at elevated risk of fracture, identifying osteoporosis can help guide treatment and prevention. But there is a major difference between measuring bone density and understanding your actual fracture risk. The scan gives you a number. Usually, that number is expressed as a T-score, and once people hear a number below a certain threshold, they can immediately think, my bones are failing. But bone health isn't quite that simple. Your age matters. Your previous fracture history matters. Your medications matter. Your family history matters. Your overall health matters. Your risk of falling matters. And your bone density is only one piece of the puzzle. This is especially important because the real catastrophe we're trying to prevent isn't a bad number. It's a fracture. And for an older adult, a hip fracture can change independence dramatically. So here's the question I want you to ask. What is my actual fracture risk? Not simply, what is my T-score? If your doctor recommends medication, ask why. What is your estimated fracture risk? What benefits would treatment provide for someone with your particular risk profile? What are the potential side effects? How long would you take it? What non-drug measures should you be doing at the same time? Because protecting your bones after 60 is not just about medication. Strength training, balance training, appropriate weight-bearing activity, adequate nutrition, correcting vitamin D deficiency when present, reducing fall hazards, reviewing medications that increase dizziness, and maintaining muscle strength can all matter. Think about that for a moment. The strongest defense against a devastating fall may not begin inside a scanner. It may begin in your legs, your balance, your strength, your home, your daily movement. That's why I don't want you to become obsessed with a single number. I want you to understand the entire system. And now we're at number 1. This is the one I want you to remember, because it represents perhaps the clearest example of the difference between finding something and helping someone. Routine EKG screening when you have no symptoms. An electrocardiogram is an incredible medical tool. It can help evaluate chest pain. It can detect certain rhythm abnormalities. It can provide important information when someone has symptoms or a known cardiac condition. But here's the question. What happens when you perform it on someone who feels completely healthy, simply because they're over 60? The machine produces a tracing. And sometimes that tracing contains something that looks unusual. Maybe an electrical pattern, maybe a rhythm variation, maybe a computer-generated interpretation. And suddenly the word abnormal appears. Now the doctor has a dilemma: ignore it or investigate it. And understandably, many doctors choose investigation because nobody wants to miss a serious heart problem. So the patient gets another test, maybe an echocardiogram, maybe ambulatory monitoring, maybe a stress test, and occasionally more invasive evaluation. The original person walked into the clinic feeling healthy. Now they are thinking about their heart every time they climb a staircase. That psychological shift matters. But here's the crucial distinction. If you're experiencing chest discomfort, unexplained shortness of breath, fainting, unusual dizziness, palpitations, or symptoms during exertion, that's completely different. Now, there is a reason to investigate. You're no longer testing a healthy person at random. You're investigating a signal. And that is the principle I want you to remember from this entire video. Symptoms change the equation. Risk factors change the equation. Family history changes the equation. Previous disease changes the equation. Medications change the equation. Your goals and life expectancy change the equation. Age alone should not be the only reason to order a test. So let's put the 5 together. Number 5, routine thyroid ultrasound when there are no symptoms. Number 4, enormous untargeted blood panels that create a long list of borderline results. Number 3, PSA screening decisions in older men without considering individual risk and what happens after a positive result. Number 2, bone density results interpreted without looking at actual fracture risk. And number 1, routine EKG screening in people without symptoms or a specific cardiovascular indication. But I want to make something absolutely clear. This list is not a command to refuse these tests. That's not what responsible medicine looks like. Your personal medical history may make one of these tests completely appropriate. You may have symptoms. You may have a strong family history. You may already have a medical condition. You may take medications that require monitoring. Your doctor may have a very good reason for recommending a test. That's why the most dangerous thing you could do after watching this video would be to take 5 rules from the internet and apply them blindly to your own body. Instead, take 5 questions, write them down, bring them to your next appointment. Question 1. What exactly are we looking for? Question 2. What happens if the result is abnormal? Question 3. How likely is this test to actually benefit me? Question 4. What are the possible harms of testing or treating something we find? And question 5, would you recommend this test differently if I were younger or if I had different risk factors? Those 5 questions can completely change the quality of a medical conversation. because healthcare should not be about collecting the largest number of tests. It should be about making the right decisions for the right person. And after 60, that becomes even more important. You are not a collection of lab values. You are not a T-score. You're not a PSA number. You're not an EKG tracing. You're a person. You have people you love. You have places you want to go. You have memories you want to make. You have grandchildren you may want to chase around a park. You have mornings when you want to wake up without fear. And that's what preventive medicine should protect. Not simply a perfect medical chart, a meaningful life. So before your next checkup, don't walk into the office thinking, I need every possible test. Walk in thinking, let's find out what actually matters for me. Because sometimes the best medical decision is a test. Sometimes it's treatment. Sometimes it's monitoring. And sometimes, after a careful conversation, the best decision is not to do something simply because it can be done. That isn't neglect. That's thoughtful medicine. And if this video made you reconsider the way you approach your next doctor's appointment, send it to someone over 60 who needs to hear this. And tell me in the comments, have you ever had a routine test lead to another test, then another appointment, and suddenly become a medical problem you never knew you had? I want to hear your experience, because the most important health conversations aren't always the ones happening inside a laboratory. Sometimes they're the conversations we have before we ever agree to the test. Take care of yourself, ask questions, understand your options, and never be afraid to ask your doctor one simple thing. Doctor, if this test